In this video, we will discuss something more about consent, like consent from whom, as well as performing additional surgery without the consent of patient. What are Supreme Court's observation in this regard? Once again, I am referring here Samira Kohli judgment delivered by Supreme Court in 2008. In this case, doctor obtained the consent of the mother of the patient for hysterectomy and salpingo-oophorectomy when patient was undergoing laparoscopy. Doctor submitted that the consent given by the patient's mother for performing hysterectomy should be considered as a valid consent for performing hysterectomy and salpingo-oophorectomy. Supreme Court observed, in this case, the patient was neither a minor nor mentally challenged nor incapacitated. When a patient is a competent adult, there is no question of someone else giving consent on her behalf. Even there was no medical emergency during surgery. Supreme Court further observed the patient was only temporarily unconscious, undergoing only a diagnostic procedure by way of laparoscopy. Supreme Court says the doctor ought to have waited till the patient regained consciousness, discussed the result of the laparoscopic examination, and then taken her consent for the removal of her uterus and ovaries. Supreme Court further observed, in the absence of an emergency and as the matter was still at the stage of diagnosis, the question of taking her mother's consent for radical surgery did not arise. Supreme Court further observed, therefore, such consent by mother cannot be treated as a valid or real consent. Supreme Court says, further, a consent for hysterectomy is not a consent for bilateral salpingo-oophorectomy. This issue once again gives us an important take-home message. The message is, where a patient's consent is taken for a particular procedure, that consent cannot be used for an additional procedure, except in emergency to save the life of the patient. If there was no imminent danger to the life or health of the patient, then the doctor should not proceed without the consent of the patient. Thank you so much.